Accidents happen as a fact of life. An accident plan can help with unexpected expenses. Aflac Group Accident can pay a benefit based on the injury you sustain and the various treatments and/or services received, regardless of what is covered by your medical insurance. Plan features include: there is no limit on the number of claims. This plan supplements and pays regardless of any other insurance programs. Benefits are available for spouse and/or dependent children. It provides 24-hour on and off-the-job protection. Benefits are for both inpatient and outpatient treatment for covered accidents. It is guaranteed issue, meaning there's no underwriting required to qualify for coverage. Premiums are paid by convenient payroll deduction. There is an immediate effective date, meaning that coverage will be effective the date the employee signs the application. You may choose to cover yourself, your spouse, and your unmarried children up to the age of 26. John just had a heart attack. Luckily, he is enrolled in the Aflac Critical Illness Plan. This plan will pay him a lump sum cash benefit to help with the cost for his treatment or to use for other expenses like household bills and groceries while he is in recovery. Aside from heart attack, the Critical Illness Plan also covers illness such as stroke, major organ transplant, kidney failure, and more. Should John suffer another heart attack, as long as it occurs more than 12 months after his initial attack, Aflac will pay him the full benefit again under the plan's reoccurrence feature. If John suffers a different illness, such as a stroke, as long as it occurs more than 6 months after the heart attack, Aflac will pay him the full benefit again under the additional occurrence feature. Aflac wants to encourage John to take an active role in his health. For this, Aflac will pay him $50 a year to get a wellness test. John's coworker Mark heard about the benefits John received for his illness and wants to enroll in the plan himself. Mark can choose a benefit amount up to $30,000 without any medical questions, or up to $50,000 with underwriting approval based on a few health questions. He can choose up to $30,000 of coverage for his spouse. $15,000 can be chosen with no medical underwriting. His children are covered at no cost at 50% of his benefit. This plan is portable, which means Mark can take his coverage with him if he leaves his current employment. Certain stipulations apply. The Aflac Group Hospital Indemnity Plan provides cash benefits directly to you that help pay for some of the costs, medical and non-medical, associated with a covered hospital stay due to a sickness or accidental injury. Benefits are paid for covered sicknesses and accidents. Coverage is available for all family members. Guaranteed issue coverage is available. Premiums are paid through convenient payroll deduction. There are no pre-existing limitations or waiting periods. Benefits don't reduce as you get older. Coverage is portable with certain stipulations. An annual health screening benefit is included, and benefits are paid regardless of any other medical insurance. You may choose between a low option and a high option. You may cover yourself and your spouse, yourself and dependent children, or your family. Dependent children are eligible up to the age of 26. The Aflac Group Hospital Indemnity Plan provides cash benefits directly to you that help pay for some of the costs, both medical and non-medical, associated with a covered hospital stay due to a sickness or accidental injury. Benefits are paid for covered sicknesses and accidents. Coverage is available for all family members. Guaranteed issue coverage is available. Premiums are paid through convenient payroll deduction. There are no pre-existing limitations or waiting periods. Benefits do not reduce as you get older. Coverage is portable with certain stipulations. An annual health screening benefit is included. And benefits are paid regardless of any other medical insurance. You may choose between either a low or high plan. For more information, please refer to your benefits booklet or speak with a Mark III representative. Employees may purchase coverage for themselves and their spouse, themselves and their children, or themselves and their family. Children are eligible under the age of 26. In addition to the short-term disability plan, Sarah may also choose to enroll in the long-term disability plan through AUL, a One America company. Like the short-term, the long-term disability plan covers her on and off the job 24 hours a day. With the long-term disability plan, Sarah can choose a monthly benefit up to $2,000 in increments of $500, not to exceed 60% of her monthly salary. Should she become totally disabled, Sarah's benefits would start paying after 90 days of disability and continue paying for up to 5 years if she becomes totally disabled before the age of 61. If Sarah has the short-term disability plan as well, benefits would begin immediately or after 7 days, depending if her disability was due to an accident or illness. Since both plans are offered through AUL, she would have a seamless continuation of benefits from the short-term plan to the long-term plan. Let's look at a scenario to see how her benefits would work. Sarah has a short-term disability plan with a $1,700 monthly benefit and enrolls in the long-term disability plan with a $1,500 monthly benefit. Sarah is involved in a serious accident. Her doctor says it is going to be at least a 2-year recovery period and she will not be able to do any work. Since her disability was due to an accident, benefits begin on the very first day and she will receive $1,700 each month for 3 months. After 3 months, her benefit will drop to $1,500 per month. The $1,500 per month benefit will continue through her recovery period up to a maximum of 5 years. So let's say Sarah recovers and is able to return to work after 30 months off the job. Her benefits will have totaled $45,600. What a great income protection plan. To make it better, these benefits are not taxable. If this is the first time the long-term disability plan is being offered to you, you are eligible to enroll in the plan with no medical questions asked, up to the $2,000 maximum. However, should you choose to enroll at a later date, you will be limited to electing a $500 or $1,000 monthly benefit. New enrollees will be subject to a 12-month pre-existing condition clause, meaning pre-existing conditions will not be covered the first 12 months of the policy. A pre-existing condition is defined as something for which you have received consultation, treatment, or medication within the 3 months prior to the effective date. Aside from health and life insurance, disability insurance is the most important coverage to have. Why? Because it is paycheck protection. Disability coverage is designed to ensure your income should you be unable to work due to an injury or sickness. Let's take Sarah for example. The short-term disability plan offered through AUL, a One America company, pays in addition to sick leave and any other insurance such as workers' comp. So if Sarah has sick days built up, she does not have to exhaust them before her disability plan will pay. Benefits are paid directly to Sarah, and she does not have to claim it as income on her taxes since premiums are paid after taxes are taken out of her check. This plan covers her on and off the job, 24 hours a day, and provides income should she become disabled due to a sickness or as a result of an accident. There is a 0-7 elimination period, meaning benefits begin on the first day if Sarah were to be disabled due to an accident, and on the 8th day due to a sickness. AUL has granted guarantee issue coverage with a few conditions. This means there is no medical underwriting to increase or obtain coverage. Let's look at these conditions. Sarah's coworker Monique did not elect coverage during the initial enrollment period. Therefore, she is only eligible to sign up for a $500 to $1,000 monthly benefit without medical questions, subject to the pre-existing condition clause. Sarah, who is currently enrolled in the plan, can increase her coverage up to $500 per month, not to exceed the greater of 70% of her gross monthly income, or $2,000. Each following year, employees will be eligible to increase their monthly benefit by $500 without medical questions during the annual enrollment period. Please note, new enrollees like Monique will be subject to a 12-month pre-existing condition clause, meaning pre-existing conditions will not be covered the first 12 months of the policy. A pre-existing condition is defined as something for which you have received consultation, treatment, or medication within the 3 months prior to the effective date. If you currently have coverage and are increasing your benefit, like Sarah, only the amount of increase will be subject to the pre-existing condition clause. Would you like to get reimbursed for out-of-pocket health care and child care, aged adult care expenses with tax-free dollars? If so, the Flexible Spending Account is for you. Flexible Spending Accounts, or FSAs, allow you to pay certain health care and dependent care expenses with pre-tax money. The key to the flexible benefit plan is that your eligible expenses are paid for you with tax-free dollars. You will not pay any federal, state, or Social Security taxes on funds placed in the plan. You will save approximately $27.65 to $37.65 on every $100 you place in the plan. The amount of your savings will depend on your federal tax bracket. With a healthcare FSA, you can pay for your out-of-pocket healthcare expenses for yourself, your spouse, and all of your tax dependents for healthcare services that are incurred during your plan year and while an active participant. The Daycare Aged Adult Care FSA allows you to pay for daycare expenses for your qualified child dependent with pre-tax dollars. Eligible daycare aged adult care expenses are those you must pay for the care of an eligible dependent so that you and your spouse can work. Let's look at an example to show how you might save with an FSA. Sue participates in both the Healthcare FSA and Dependent Care FSA to save on dependent care expenses. Let's compare Sue to Amy, who does not take part in the FSA, and see how Sue saves money. Both Sue and Amy have a monthly salary of $3,000. Each spends $100 per month on medical expenses and $300 per month on dependent care expenses. Sue uses the FSA, so she is going to set aside a total of $400 before taxes come out of her paycheck. Amy sets aside nothing. That makes Sue's taxable income $2,600 versus Amy's $3,000. Taking out roughly 30% for taxes, Sue's take-home pay is $1,820, while Amy's take-home pay is $2,100. Now, while Amy comes out on top here, she still has to pay her monthly medical and dependent care expenses. So let's subtract $400 from Amy's pay. Sue set her money aside pre-tax, so we will not subtract anything from Sue. Now Amy is left with $1,700 and Sue is left with $1,820. You see that by using the flexible spending accounts, Sue is saving $120 per month. That's a total of over $1,400 for the year. Flexible Benefit Administrators provides you with a benefit card, which can be used as a direct payment method for eligible expenses incurred at approved service providers and merchants. Using your card allows you instant access to your funds with no out-of-pocket expenses. Please keep all of your itemized receipts. Flexible Benefit Administrators may request documentation to substantiate benefit card transactions to determine eligibility of an expense. Plan carefully. Unused funds will be forfeited back to your employer as governed by the IRS's Use It or Lose It rule. You will be eligible to join the plan if you are a full-time employee, working at least 30 hours or more per week on the first of the month following your date of hire. Employees having a qualifying event are eligible to enroll within 30 days of the qualifying event. Deductions begin on the first pay period following your plan start date. Remember, you must re-enroll each year during the enrollment period. If you do not re-enroll during the enrollment period, you must wait a year to enroll in the next open enrollment unless you have a qualifying event. PPCN is an independent third-party contractor that partners with employers to deliver Health Map RX, a voluntary chronic condition care management program designed to support covered health plan members. Those eligible for the program have been diagnosed with diabetes or prediabetes and are taking medication. If you are looking for additional support, wish to earn participation incentives, and reduce out-of-pocket prescription costs, then Health Map RX is for you. Health Map RX is confidential among essential PPCN staff, the pharmacist care manager, and the participant. Your employer or health benefits sponsor will not have access to the personal health information of any program participant. The enrollment opportunity is ongoing, so a potential participant can choose to join when he or she is ready. Once enrolled, the program has no graduation or specified end date. Once enrolled, participants meet face-to-face with a pharmacist care manager, typically on-site during work hours for 30 to 45 minutes. Sessions are approximately monthly for the first 3 visits, then quarterly thereafter, resulting in 4 to 6 visits per year. During visits, self-management goals related to nutrition, physical activity, general lifestyle, and condition-specific standards of care are mutually identified using issues and concerns relayed by the participant and feedback from the pharmacist care manager. These goals are monitored and discussed, then updated at each visit. HealthMap RX participants receive valuable incentives. Incentives may include waived or reduced copays on generic condition-related medications, preferred brand condition-related medications, preferred brand diabetes testing and administration supplies, prepaid physical or digital incentive award distributed twice per year for compliant program participants who attend required pharmacist care management visits or other condition specialists, maintain regular visits with a primary care provider, and provide required condition-specific lab results. Incentive offerings are selected by program sponsors and may vary or change. If you are interested in enrolling in HealthMap RX or need additional information, contact PPCN Program Support at 336-580-0340 or email at admin@emailmm.com. You may also enroll today at ppcn.org/healthmaprx.html. Over 1.5 million new cases of cancer were diagnosed in the United States last year. This is no surprise to Jane. She has family and friends who have or have had the disease. Even though Jane has health insurance, she plans to enroll in the MetLife Cancer Plan, which will give her extra income should she get cancer herself, so that she can pay for things like deductibles and coinsurance and household expenses like her mortgage, utility bills, and groceries. The cancer policy pays cash directly to Jane for the treatment of cancer or 32 specified diseases. This includes benefits for radiation and chemotherapy, hospital confinement, experimental treatment, blood and blood plasma, and much more. Let's say Jane has to travel to a hospital in another city for treatment. So Jane is not alone in her treatment. MetLife will help cover the cost of one adult family member to be with her. You care about your pets and consider them members of your family. So whether your family includes kids with 2 feet or kids with 4 paws, or both, you know what responsibility looks like. So why not give your pets the best health care available? The My Pet Protection Suite of pet insurance plans offered by Nationwide is composed of the only plans specifically designed for employees and gives you superior protection at an unbeatable price. Features include 90% back on vet bills, exclusivity, unavailable to the general public, one set price, regardless of the pet's age, the best deal anywhere, an average savings of 40% over similar plans from other pet insurers, and a wellness plan option that includes spay and neuter, preventive dental cleaning, and more. Plus, if you sign up multiple pets with individual plans, you can receive a discount for even more savings. Just like all other pet insurers, this plan does not cover pre-existing conditions. However, Nationwide does go above and beyond with extra features, such as emergency boarding, lost pet advertising, and more. Plus, both plans have a low $250 annual deductible and a generous $7,500 maximum annual benefit. Apply today and give your pets the best in healthcare. There are two vision plans offered by Superior Vision. The Exams and Material Plan covers materials plus comprehensive eye exams. The Materials Only Plan covers your choice of prescription glasses or contact lenses. Superior has a huge network of ophthalmologists, optometrists, and retail chain locations. Under the Exam and Material Plan, you may get an eye exam every 12 months, and it is covered in full from an in-network provider after a $10 copay. Even if you don't need vision correction, it is important to get an annual eye exam, as eye care providers may find ocular diseases like macular degeneration, glaucoma, and cataracts, or systemic diseases like diabetes, hypertension, and high cholesterol. Under both plans, subscribers may buy frames every 12 months. There is a $150 retail frame allowance after a $10 copay. If you choose frames more expensive than the allowance, you get a 20% discount off of the overage amount. Standard lenses are covered in full, and you may get them every 12 months after a $10 copay. There are a lot of lens options and upgrades like UV coating, anti-reflective, factory scratch coating, and tints. Most are available at a 20% discount. If you choose contact lenses instead of glasses, you may get them every 12 months. There is a $150 allowance with no copay. Your eye care provider may require that you have a contact lens fitting exam for the proper fitting of your contacts. This is in addition to your eye exam. Standard contact lens fittings are covered in full after a $10 copay. Specialty lens fittings have a $50 allowance after a $10 copay. Superior Vision's great discounts give you 10 to 30% off of an unlimited number of additional exams, frames, lens options, and contacts. They also offer discounts on LASIK. You may cover yourself plus your spouse, yourself plus your children, or yourself plus your family. For questions on your plan, how to find a provider, how to use your benefits, or for a wealth of eye and vision information, please visit their website at superiorvision.com. Whole life insurance is an ideal complement to any group term or optional term life insurance your employer might provide. Texas Life's Solution 121 is the life insurance you keep even if you change jobs or retire, as long as you pay premiums. This plan will help protect your family today and, more importantly, tomorrow. This plan is permanent and yours to keep when you change jobs or retire. Coverage begins immediately. There is a guaranteed death benefit. There is a guaranteed paid-up insurance at age 65, or 20 years if you purchase the policy after age 45. If you're actively at work the day you enroll, you can qualify for basic amounts with no additional underwriting. It includes an accelerated death benefit for chronic illness. Coverage is available for spouse, children, and grandchildren. Why do I need more life insurance? Life insurance is a core component of a comprehensive benefits package because it provides employees with essential protection for their families. However, many people depend on their group term life coverage as their only life insurance, which can put them at risk of not being adequately prepared during retirement. Permanent life insurance, such as a voluntary universal life individual policy, is a simple way to address employees' needs because it complements their existing group term life coverage. It can provide continued protection to help alleviate any financial burden, such as funeral costs, that loved ones may need to address. Why Pure Life Plus? You own it. This voluntary product is yours to keep, even when you change jobs or retire, as long as you pay the necessary premium. Refund of premium. Pure Life Plus offers you a refund of 10 years premium should you surrender the policy if the premium you pay when you buy the policy ever increases. High death benefit. With one of the highest death benefits available at the worksite, Pure Life Plus gives your loved ones peace of mind for a reasonable cost. Payroll deducted premiums means that there are no checks to write or links to click. Long guarantees. A guaranteed death benefit to age 121 and level premium that guarantees coverage for a significant period of time. Coverage for your family. You may apply for this permanent portable coverage not only for yourself, but also for your spouse, children, and grandchildren. Additional benefits and riders include an accelerated death benefit due to terminal illness rider, an accidental death benefit, waiver of premium, and an accelerated death benefit for chronic illness.